And Rosa.
We're going to go ahead and practice putting a few patients through as a group. First of all, I want to make sure everybody can get on to their computers because we had issues yesterday. Is yours working now? Perfect. Okay. So does everybody have access to the ED tracker? Make sure you're there. We're going to start on the tracker. Can anybody tell me where the first place is that we're going to go in order to receive our patient and get them on the tracker? Reception. So everybody go to the reception tab.
Cheryl's not up here. I'm not up. Just for your password?
Yeah.
Oh, is it on tab?
Reception.
Not yet, oh,
Something happened.
you're there. You're there. You have a tracker? Oh,
Okay.
go to reception.
We ready? Everybody have this screen here that you see on mine? We're going to receive all of our patients this first scenario as a walk-in. So I want you to search for your name, and actually you're going to use your nurse to, visit. So Nurse Sue, Nurse Mary, etc. No. If you get this pop-up that says this is a repeat visit, new or follow-up, make sure you select new.
Yes.
There you go. Click OK.
Continue creating account, so that's okay.
I bet he just needs to have more Oh, yeah. Because if you want to just keep after you now, she'll tell you. She's crazy.
Sure does.
Go ahead and X out. Oh, it's working. It's working.
Okay.
Sorry if I
Okay, so go ahead and click OK. This is the right patient.
Oh, okay.
There you go.
I'm power third,
Does everybody find yourself?
So what's your green thing?
Yeah.
I did, it's still.
For one.
It's,
Seems like every session has at least one computer that.
it's pretty bad when the computer's slow and the person operating is slow.
Let's start over. Go ahead and right click
One of the
And
twins
hit
today
close.
that way too. No, Roger's not.
and end now.
Roger's just doing that.
He always has been.
Well, he's always doing that. We need to do it this way when he realizes it's not right. He has to listen to it.
Oh, really?
That's what makes lots of it.
So don't just Tom realize Riley's wrong.
No, he just does it this way.
Right click.
Figures out what he wants
And end now.
Yeah,
We're gonna get you all the
Some
way out.
Riley's not powering in.
And we want to go ahead and log all the way out. So that we can know all of the extras or something.
This is one of those.
What's he going to school for anyway?
They don't.
Oh, he is. Then why does he come back and try to run the corner? Why does he do it there?
Sure, what happened?
Huh?
It's been doing that all morning long.
Oh,
Like that.
Is, Brian should be about done with school, shouldn't he?
Right, yeah.
He's got his MD, isn't he?
And now.
She is? And when do the twinners graduate?
Next year.
Did he go to college?
That's it.
Did he go to college?
Yeah.
You think so?
Okay.
double down and do something.
Had a shopper, did he?
That's true.
Yeah, I kind of remember
Really?
Ryan used to say that.
Cold out?
Tough time.
Yeah.
They just probably just.
It's windy, but not, I don't think we come out there like you said.
50, is that what they're?
45 minutes.
Yeah.
Down. I used to hate it because those libraries never stay.
Okay.
Yeah, I mean, I would come home and stay hours for semester classes.
Use mine.
My brothers.
We might end up if,
She was
And they didn't know how to
story.
install it. Yeah, it was like a whole shock.
you have her, maybe you can try that other PC.
Yeah.
I'm gonna work with math. Brian be in the kitchen, and I'd be going over something with her, and he'd blurt out the answer. She'd go, "Whoa." I'd be like, Brian, can you just?
Yeah.
Well, for Christ's sake, she should get that.
Oh.
Your second boy's not graduating, is he, so yet?
December.
Yes. And how's, Kira doing?
She graduates in 2 weeks, and she picked up a job at ICU in St. Francis. So she's pretty excited.
She's gonna take classes, or she's gonna burn out?
Well,
She's got her BSN. I don't know if she wants to go any more than that.
She don't have to, nothing else.
No, she wants to get married and have babies.
Did she get a ring yet? You guys did she get a ring? Because I haven't.
He has bought a ring, but he's not giving it to her. so.
that's what we did too, because I would cry.
Oh, that's
He
getting
do it
worse.
his
You don't
own.
know.
I know, and he said he'd do it his own time.
His own holiday.
Twice a day.
I'm guessing it's
something.
summer.
I'm just like traveling. Because I mean, it.
For Safe Roy?
Oh, she
And getting married
Oh,
too.
really?
Did you know she's getting married in
Oh, is
September?
She is.
So she had a boy home with her from school, because we talked to her dad about it.
Yeah.
Well, they didn't know.
Really? September 21st or something?
Oh.
She graduates with.
All right,
Scott's
let's
what,
try
I
this
think.
again.
Yeah,
So
she's-
go into that
Yeah, I think
reception
so.
tab, Mary.
I mean, she started out wanting to be a doctor, and then she changed it. I don't know if Beth, she's still gonna be a doctor?
I bet so. She's
I bet
pretty
she
good.
will,
She's-
too.
Yeah, she should be about done with the shadow, shouldn't she,
I
Beth?
think she'd be moving on.
Yeah.
I live with Mary next year.
Could you get in under your own name, huh? Good.
That's what I figured. So arrogant.
Okay.
Just a pudgy little thing. It's got one cute little thing.
Yes, brothers, Greg and Dan are friends.
And Eric went through.
Greg is
Oh, thank you.
in
Yep.
wiring.
Sarah R.
And Dan is.
Oh, okay.
He is dry.
Okay. So everybody's here at this reception routine. Does anybody remember the one area that we have to check mark in order to process and
Verify.
receive?
Date of birth.
Yep. Verify our date of birth.
Good job.
While we're in this reception routine, let's go in and enter our ED provider and our ED nurse.
Now, are they gonna add our PAs?
They are listed in our ED mid-level.
No.
So you can select a mid-level too if you'd like.
Yeah.
Would we, so if, say Jessica's on call and Kramer's covering, do we put them both in?
So you do that now?
Okay, go ahead and click save.
So now you don't have your nurse.
You should get this soft stop warning saying the following fields are missing, stated complaint.
Just wait, somebody's thinking.
It is a soft stop, it will allow you to bypass, you do not have to put in a stated complaint if you do not wish. You can go ahead and say continue with save yes.
Now you're gonna get that soft spot she just talked
Click them out. See if you can.
You can touch it,
I'm just giving my hand. It's
about. She got it all?
I'm thinking you're probably gonna have to go to a different, computer.
I'm on over there, but I don't know if you wanna take me off and get on soon.
Is that okay?
Is that what you wanted to go off?
Yeah,
Probably.
you'll have to log off your first.
Yeah.
I can't get it unfroze.
Yeah, she did.
Allow
Yeah.
you
Yeah.
to-
Here, okay. You need to,
You can't even use the mouse.
Patsy did get it unlocked.
Never mind, there's,
Okay, biggest.
She can't plug it here, but
Oh, yeah, I put
it's
myself
probably still gonna pop up to the same screen.
Allison's working longer than it has been before.
It's a good
That's
day.
reassuring, huh? Isn't it?
oh, it's okay, right, I can't find it, is it?
I like these keyboards though. Wish we had these all over there.
Okay, so we just take her out.
Yeah.
Maybe, does she want to come back in?
Yeah, go ahead and log her on.
Yeah.
Coming in back.
Yeah. Bring it up.
Janelle, so this face sheet eventually, will we want to print the face sheet when we're after live?
Yeah. Okay. Do you want to just stay on lollies for now, and
Is
then
that
next time around we'll have you,
Sure.
at the next break, we'll have you log in as yourself. That'll be fine.
And you started your film again now.
So for right now, we are not going to print the face sheet, but you could at this point. Now everybody should see yourself on the tracker. Everybody there?
Pick up the name. There. Okay. Cheryl, you do?
Okay. Go ahead and highlight your patient in green. And does everybody remember the next tab we're going to go to? After we receive? Nobody? Triage. Right under reception is triage. Okay, here in the triage tab, again, a lot of the same information we already saw in the reception routine. We have not entered in our chief complaint yet, so I would like for you to click in the chief complaint cell and type scheduled ER. You'll get a pop-up that says, do you want to process the orders? We are not going to go directly to orders, so click continue. Everybody have a chief complaint inputted, scheduled ER?
No,
Then you just hit continue.
I did on this.
Hit continue, we won't process
I'm
the
sorry.
orders.
Didn't read it.
And then continue there.
Continue.
There you go. It should be up there.
Okay? Does
Okay.
can anybody tell me what else we will document here from the triage tab?
Don't you put in assessment, you're probably gonna do
You can put in the assessments if you'd like, right from the triage tab. For now, first thing we want to go to is allergies and home meds at the top of the form, or top of the tab. So go ahead and launch into allergies and home meds. If you have allergies present, I would like for you to go in and confirm the allergy. If you do not have any allergies listed, I want you to enter in a new allergy. If you don't recall to confirm, you're going to click on Edit Allergy. You're going to check mark the allergies that you're confirming. And then down at the bottom of your screen, there should be a little confirm button that's now highlit. You can click that button. Mine doesn't have it because I have different access.
Maybe the aides can't do that.
Right, if you're an aide,
You can't do
a
that.
CNA, you probably will not have access to edit allergies.
Okay. I didn't know
You probably.
So I
save.
confirmed it, and then do you save it, or what? Because it didn't
Once you
happen.
confirm, yes, click
Oh.
save.
Did you get yours?
So did you have one already present?
No.
No, so you're in
So
your
I
one.
added.
Okay,
So
that'll work.
I'm going to have to mark this up here.
No.
Oh, okay.
Go ahead, it should allow you to save.
Oh, okay, all right. Oops.
Amber, you're doing okay?
Yeah, I'm just, if for some reason it's not
Did you
saying
have any
confirm.
present or did you have to enter a new one?
Sometimes it's verified.
Did you have any present?
I had one.
You had
Well, I
one,
had
so
to
go ahead and
confirm
click
down
the
here.
edit button for me.
Oh,
But
Click
I
on
can't
audit.
verify that that's the,
no, because that's pharmacy.
right, so when I hit confirm.
And there's your timestamp.
Does it check them off?
Oh, so
they're
I
checking,
should
no,
confirm
yeah.
it. Okay, I
Yeah.
wondered how I
I
hit
hit
that.
save.
On
Right,
that
it
for
says
me
save.
too, would you
It
please
says
edit
unverified.
and audit?
I think it's unverified, but doesn't take 600 someplace else.
Yep, you just went through.
Already.
I still have. Did you enter a new one or just
I
confirm?
entered a new one.
You entered a new one, okay.
No, these are
So now what do I do?
old ones.
So if we go in, it's
showing me that you confirmed.
Well, I know that, but do we
Check,
X out
right?
then, or?
Yeah, you can hit cancel.
one at a time. I think, I don't know if you can do one or two at a
Okay,
time. Confirm it and save it. And then go.
now go back into edit and click audit, Amber, and then we should be able to see your timestamp.
Oh,
Okay.
well, I confirmed them a lot of times.
Okay.
There you go.
Okay.
Okay,
'Cause we have
so
to
now
get-
let's do the same process for home meds. If you do not have a home med, enter in a home med. If you do have a home med already present, we want you to confirm the med that is present.
So if you're gonna enter the edit too.
Does Karen
Oh, I
not have
don't know.
access?
Probably not.
Okay.
AIDS probably will not either.
Okay.
In order to reconfirm meds that are already existing, it will require you to input a last taken for each medication as you're confirming each med.
But now it's gonna take care of them. Take them on.
Oh, because it's doing all of them.
So if you gotta slug them, it takes a little while. What about you putting in?
It will.
I did say last taken.
Cancel.
But it doesn't show
You had to put it in one end, and you'll be able to confirm next time around. We got today's ability on the date and the time. And on there.
It's not the time I put in.
You did.
Oh, yeah, I did too. I'm looking at 1,300, yeah, oh, jeez. Losing my mind.
Last confirmed, okay.
Does it say it on there?
Yeah, it did over here.
And then cancel. We're
Oh,
not gonna print
okay.
any forms.
Alright.
And now do the same, go back to edit, and then snapshot again, so we can just confirm, or audit, sorry, so we can confirm. Here's your trail that you audited these meds on that date.
No, not the names.
Okay, check them, okay.
What is daily under? D, I can't find daily.
2 a.m.
Oh, okay.
Did everybody either enter home meds or confirm home meds? Ready to move on? Okay, we're gonna cancel out of that screen. We're gonna go back to this triage tab.
Since I didn't do it, I couldn't do it.
Okay, let's go back to the triage.
Okay.
There you go. I think that's what she wants us to do. Did you flip you out? Okay.
Okay, now if we wanted to launch right into documentation from the triage tab, we could. For this training session right now, we're actually going to open our patient chart and start documenting from the work list. So go to open chart. Okay. You see there's a couple documentation sections that are required. How do we know which ones those are? What's that?
Have we got them all in there now?
Your star?
Yeah.
Yeah, the red asterisk signifies these are the 2 interventions that are associated with.
I don't have the same screen.
I don't either.
Hit work list.
Oh, you need to go, yeah, go to the work list, sorry.
I don't know, so I guess we'll have to go. Let's just go to
So we have a medical screening exam and admission verification. Two pieces of documentation that we're going to document on for a scheduled ER patient.
So this list comes up automatic on everybody.
Yep, yep,
Because I'm in Lolly's, I don't have what you have.
shouldn't matter.
Okay.
Did you enter in a chief complaint of scheduled ER?
Mm-hmm.
Can you go ahead and go back to your tracker? Scheduled. Okay.
Because it's she, I
So
don't know.
these two can.
Well, it shouldn't matter because those assessments flow with the chief complaint. You didn't delete anything off, did you?
Not that I'm aware of, no.
Okay, open that chart back up again for me. Oh, now it's there.
Oh,
I don't know
great.
why it wasn't
Okay.
there the first time. That's kind of weird.
Well, it comes up.
Janelle,
Okay.
just a question here. Sarah was, I don't know if, we don't know if she would have, she flipped clear out. So anyway, there's so many Sarahs, and she's in ER there now, but she can't hide
Here's my pre-ER, can I get back to that?
Or should she
You're
just
not
rename
gonna,
it?
you shouldn't disappear, so you should be on the
So can I
cancel.
not here anymore?
Don't save it.
That's how I am.
Cancel? And she can't find her.
Scroll bar here.
But it's better nothing than he's gonna have to.
There you are.
But he needs to talk.
I was gonna say, I don't think you're gonna just disappear.
Come back to triage. Looks like she's on the work list.
That's my opinion. Kind of, I just go in because I was asking him, what do you think that's what he's gonna do?
Does everybody have their work list pulled up?
Yep,
Okay.
we're okay.
There's a couple things on this work list that we can get away, we can get rid of right away. We know we're doing a scheduled ER. We do not require documentation on a Glasgow coma scale for a scheduled ER. So if you click in the status due column of the Glasgow coma scale, you can set that to canceled, and that will fall off your work list.
Got her? Okay.
Okay? Same thing with the ED flow sheet. We do not fill out the full documentation on an ED flow sheet for a scheduled ER in most cases, so we can select that one to cancel. And if our patient is presenting for something not associated with any pain complaints at all, say they're just coming over for a routine bag of IV fluids, pain assessment is not required, so we're going to change that to canceled. Okay? I do want you to go in and document a medical screen on the scheduled ER patient. This will be a new process for scheduled ERs. We do want some documentation that we're confirming they're not in an emergency medical condition. So we will fill out this medical screening exam documentation. So go ahead and complete that documentation.
Check, and then you can do it. Yeah, do it. You sure you do it? Practice, even if you're supposed to all practice.
Okay.
I'm just putting what she's putting.
Practice, practice.
And under this too, are we all supposed to be in caps lock, or does that matter?
Caps lock shouldn't matter. I mean, yeah.
Oh, because admission said something that we should do it all. Caps
She
lock.
said,
Council, what does that matter?
Just for everything.
Just one of those with the scheduling.
I'll help you here.
Location.
You need to go to your work list. There you are, where you are. And
Put the scheduling.
just document,
Which would be our request, right?
Hard.
and then she wants you to fill out
Break
and not all of it that you can get by with, just put some stuff in there, okay?
For training purposes today, if your job provider type probably won't allow you to document in some areas, and we may have you document in some things you wouldn't normally document on, but you just know it's for training purposes today while we go through and process patients. But when you're in the real life situation, obviously you're only going to be documenting on the areas that you normally document in now. So as a tech, you wouldn't be really completing the
Just
medical
kind of go
screening
through that.
exam.
Okay. Asterisk ones you have to fill out. So if you see the little asterisk ones. You see it?
Where do you put, like, on the O2 says Romare or?
That's a good point, I didn't think about that.
Must have right there on it too.
You may need to add that additional, if you go into vital signs and open that up,
What's wrong with that? I thought this was a schedule patient.
O2 delivery method is listed there. We probably just need to add it to our medical screening exam.
Okay.
So would you technically put those in there, like, since it's a scheduled patient, you technically wouldn't need these vital signs in, would you? This task, because you've already got them in the initial part?
Right, if you've documented them there, I wouldn't take them off until you're ready to discharge the patient though, just in the event you don't end up having to add additional sets of vitals. But yeah, if you've captured them in your initial screen, then you don't have to document.
Just see if you can find it.
So what about down here on medical screening comment? You don't,
You don't have to type a comment if there is
Last
anything
post scale,
applicable.
won't need that. This was-
Then you just save it?
I'm sorry, on the class. You gotta go to here,
No.
we don't need it. Just see where we go. Pain assessment, yeah. Okay, all right.
We ready?
I'm looking to see. You got yours done? You girls are done? Yeah. We're okay. We're kind of.
Okay. The next thing I want you to go in and document on is that admissions verification. It's basically 3 queries, just asking or reminding, did you do these things? Did you verify allergies, home meds, and vaccinations?
Okay, document you. There you go.
We will be compiling home meds, allergies for scheduled patients. We want to get as complete of a medical history established in our system as we can. In order to do that, we need to address those areas when the patients present, regardless what they're coming for. And I know we talked earlier, in the clinic, they'll be obtaining home medication lists also. We'll be doing the same thing. I mean, obviously, if it's a schedule and they're coming in for repeat visits, it's just going to be a matter of reconfirming, because once we have them in the system, more than likely they're not going to change all that much from visit to visit.
And their vaccines, are you talking
So I've
flu
looked
and
at
pneumonia?
allergies and home meds, how do I verify vaccinations?
Where will we input vaccinations? Do you remember, Mary?
No.
No. In the summary tab. As far as vaccinations verified, main thing we're looking at is tetanus vaccination for the ER. Now, if it's a situation where they're going to the floor, then that's when we would concern ourselves with flu and pneumonia. Okay? So this is reminding us, nope, we did not verify the vaccinations. So go ahead and document and click save, and let's go right into those, into the vaccination documentation, which is in the summary tab. Your EMR. This will take a little while to load because it's pulling in all previous documentation.
You got it here.
Does everybody have this screen displayed yet? Still thinking on some people?
Kate, do you have yours? This is okay. It looks a little different from the first, but otherwise.
I think my screen is just a little lighter.
Yeah.
Under immunizations, if you click on edit, if you have a tetanus immunization already inputted, it will display. You're going to want to just review that with the patient. If you do not, you can go in and document a tetanus status. The system does require us to have an actual date of the last tetanus shot. And oftentimes our patients don't know an exact date, so we're asking just to get as close of an estimate as you can. Even if they only know the year, put the first of the year so that we at least have a fairly close estimate of the last tetanus shot. They can remember if it was spring or fall. If it's fall, put September. If it's spring, you know, put April, that kind of thing.
Now.
Does everybody have a tetanus vaccine inputted?
No.
If you don't, go ahead and add one. If your user type will allow, like I said, we probably can't do that.
And vaccine given. Yes. Okay. Anything else? Yes. Okay. And you have to get
There's all
down.
sorts of information.
Just left the
Define pastors.
Yeah, here's where you're gonna try to get as close to a date as.
Because you gotta have,
That's it.
you gotta have manufacturer, or which one is it, lot number? And,
What's that one?
don't we have to put the lot numbers?
If we're administering it, we're not administering it here, we're
She's
just
gonna put it in.
we're just documenting
I'm just documenting
that
that.
the patient is telling
So
us
say
the
that.
last,
Yep,
yeah.
if you're administered.
Which I would say so.
Okay. Okay, everyone's okay. Yeah,
Bless you.
Are you adding yours?
I did, but I don't know how to do it for today's date, or should I have?
Oh, I did.
Well,
Doesn't matter.
And reason not given?
no, it will be vaccine given, yes. And then just the source is the patient telling us.
And that's all we did, that was just, we never get there.
Okay?
Good job. Did you get yours in, Sharon?
They won't let me know theirs.
All right, so we review our immunizations, so go ahead and cancel out of the
So do we have to
summary.
audit that to confirm it, or we're okay? Just-
No, I have a note to ask Jess about that, because there is not a confirm button on the immunization footer button, so, I gotta check to see if there's a setting for that. Okay, let's go back to our work list.
We're not quite ready to know.
Oh, okay.
Sorry.
Okay, yeah, we go through again, patient, reason.
It just-
Asterisk.
We've gone all the way.
I saved it as low lit, so it won't let me save it, and all my asterisks are filled.
What's the matter?
Effective date.
Your stomach hurts?
Say yes. Oh, well, even that one, but I can say because okay, you got it, good.
The effective dose was under no.
Oh,
Okay, yeah,
I think it defaults to yes. It has to be effective dose.
I don't know how I can do that. So now what are we going
I
to?
think she's going back to the work.
So
I just see this.
I've been hitting.
All right, everybody back here on the work list,
Okay, you there?
okay? The next thing we're gonna document on is past medical history. Does anybody remember the pathway to view a patient's past medical history?
Pay card.
Patient care, history, positives. If you have no past medical history on your patient,
Patient care.
your positives and your all responses will be grayed out.
History. History is grayed out.
My history's good.
Condition verification.
Yeah, I can't click on history.
Not
So you don't
history
have
at all.
history.
Okay, so you have no history inputted, okay?
We're newbies, Mary.
You got history? You got history?
If you had history present, this is what it would look like. Anything that they've previously told us would be listed here. So you could quickly go through the list and say, this is what I currently have, is this all correct? Are there any additions?
No history?
Okay,
No history.
so we're gonna go in and document on our past medical history.
So,
So go back to your work list,
okay.
click on the Now column of past medical history, and click Document.
You there?
I want you to go in and fill out your past medical history and select 2 abnormals. Okay, 2 things as being positive as you complete that.
Okay.
Will your provider type allow you to document in that, Cheryl? I think it will. Normally though, as a tech, you wouldn't be filling out their past medical history.
So you mark no's if you don't have it, or?
Right.
Oh, did you want that?
Just in the system, the ones with system query, you do not have to go in and mark no for every question within that system.
Yes.
Just this one?
Yep, just the starred query.
Yes on this one.
Yep, just that one.
But if you hit yes, then it's gonna pop up.
Right,
And then do 2 yeses on the rest.
yes.
You have to mark 2 yeses.
2 yeses somewhere
yeses
within
somewhere.
your assessment.
Okay, do you understand that? The yeses mean that you'll have to answer some questions.
Was there anybody that already had past medical history entered?
None of these back here did.
Yeah.
You did?
I did take this.
And you did? Amber, are you familiar with the recall button, the recall option?
Hit it,
Okay,
this
so I
one's
hit
back
yes
up.
on
Yeah,
that.
and if you click, go ahead and hit that.
Every question. And
If you
only
click
answer
this
yes.
star, it's gonna
Only answer
recall
no.
the section.
Because you answered yes.
Okay.
Okay, you just go through and say, yeah, I had angina, yes. And just go down, maybe nothing else is no.
No,
Just the ones you don't have in you.
Nope.
Okay.
no,
But you gotta have 2 yes disease problems, okay?
Mhm.
Okay,
So
not just under cardiac.
So is this okay like this?
Yes.
Yeah, it's a
Just
huge
one.
document, so
On that
it
one.
takes a little while.
Yeah,
And then
but
it's
you
all
gotta
that.
have another disease.
Yeah.
Yeah, somewhere along the line, yes. But you're under say.
Anything with a star by it requires you to answer.
Okay, you don't understand. Go to respiratory and say you have a breathing problem on respiratory. That's two different problems, heart and respiratory. Okay, maybe you wanna go on neurological, otherwise all the others can be no. You understand now?
So you just keep scrolling to the next.
You
Yeah.
won't, it's not to the next job, but I want you to document to it for processes.
If you say within
So
the
just
normal
pick
limits, you can
something.
say.
It doesn't matter.
Anything on family
Yeah.
Say
history.
yes,
It doesn't
yes,
matter.
well, that's under
Oh, there is family
Yes.
medicine.
You can just scroll down to the
Oh,
next,
no.
next section.
But you put yes here.
But then about asthma?
You can do whatever, that's fine.
Nope, that's all
And
still
everything else
part of
can
that
be-
whole section.
Now you have two problems, you have heart and everything else.
There you go, now you're into your next.
You don't have to answer no to
You
any,
can say no.
up here it says within normal limits,
To
yes.
the next one, you only have to answer
Oh,
yes.
okay.
Okay.
Yes, and then yes.
No. For some reason I was screwing up.
No, I'm not understanding it.
I know, that's
I
okay.
won't ever do this,
I know.
but I mean.
Okay, if you have respiratory problems, you're gonna put yes, and then it pulls this out, and you feel that you have asthma.
So you don't have to put on.
You don't have to put no on any of those.
Once you're into this area, the only things you put in is the yes.
But you have a problem there.
Right.
If it's a no,
Making
that's
this
You don't have to answer,
Okay.
it's done. Now go down to the next, just go
On
here.
the past, the family medical history, do you feel like if your family has a history of cancer? you
Yes.
put it?
Right.
See?
Oh, we
this
do
one,
family
no.
medical history too?
Genitary, no. No, no,
We don't do that now, do we? Family medical history?
Yeah. They ask you.
I know, I
No, but
said
we're gonna be doing
currently.
it now.
Holy shit, just for an injection?
Now?
They've been so
Okay,
yes.
alright. Cheryl, are you doing okay?
Thanks.
So you filled out two that you had problems with?
So we have to go, no, everything that's.
No, you got two
Or
in
we
there.
don't?
It says yes,
No,
that's what she wants.
Not on everything.
But
This
it's
one
asked.
doesn't, the ones that are starred.
Huh?
So that nothing that.
So this one doesn't count.
Okay, so we can have so you would have to.
This one's asked.
It's just nail problem.
This one right here.
So we did.
But my God, on this side of medical history.
Only if it applies to the if there's something else that wasn't listed above, we would click that.
So that's why you interrupt. I can do that. Okay, how's everybody coming? You don't have to do every, yes, just whatever which certain ones, you don't have to answer your no's, you just. So working out now, Karen? Okay, were you able to file it?
Not yet.
Okay. You have to do the asterisk, Cheryl. You can put them all under no. Did you do the asterisks?
Only one that, you got me on to this part, so I can.
Okay, there's two questions on smoking that you have to fill out. Okay, you doing okay, Mary?
I think so.
Okay. I see a green one there. Do you have to sign on that one? Up there? Okay,
I'm looking for.
okay. Did you try to save it? It usually goes back to right where you need it. That's what I found is the fastest way.
That's it. I mean, I'm not here.
You've entered positives.
Okay, still saying you got something, Cheryl? Then you go back, it usually reverts you back to where the green is, right there. You see that green right there? Fill it out. Yeah. Okay. Now try to save it. Oh, got another one? Is yours working out now, Shannon? Okay. Okay, look for your asterisks. So see them there?
Yeah.
That's your answer. try to file it now, Cheryl, just say.
You know,
Might be done.
I put in 2 things, but if I was actually putting in my full family medical history, holy shit.
What's your immediate family? I mean,
Yeah, I know,
Yeah.
but I got cancer, lungs, diabetes.
yeah.
Oh, man.
You're doomed.
Numbers are clocking.
So go back to the patient care tab and the history tab.
No, I don't either.
Is it still? Go ahead and if you refresh your EMR,
It's on the side. Maybe that's.
Oh,
There it
is.
shows.
and if you clicked on all responses, remember that's where you would see all your no's if you went in and filled everything out as a no.
Yeah. You don't want to do that.
Okay?
Okay?
So we're gonna go back to the work list.
Whatever it looks like.
This patient that we are taking care of as a scheduled ER has an order to start an IV. We're going to give IV fluids back in the emergency room. So how are we going to get our IV start to display on our work list? What do we need to do?
Add.
Orders?
Orders. It is an orderable intervention. We need to put it in through the orders tab. So we're going to go over here to orders.
On the side, Cheryl. Remember you're doing that? Yeah, you'll get used to it. Okay. Okay. There you go.
Your new set should be highlighted in red.
Got it?
Click on new sets. Enter in an ordering provider, can be anybody, with the source, and then click OK. Check mark the ER standing orders.
Oh, they're just calling right along with you, Jim.
Click next.
Good job. Stacy, are you
Scroll
lost?
down until you see the IV initiation order.
Yeah, just go to one more. That's okay. Just put okay.
Click that as a one-time order.
Okay, and your doctor. You won't do this normally, which is good practice. And okay.
Can anybody tell me how we would know if we needed to add additional information to this order?
The asterisk on the edit.
Right, there'd be a little asterisk right here by this edit tab. There is not an asterisk by that edit tab.
By the ER, and she's right there where you need to be.
Okay.
Thank you. But you do have it. Okay. How you doing?
So we can go ahead and submit this IV initiation order.
Did you check it? Did you check it, ladies? Huh?
Submit.
Okay, how are you? Cheryl, you got it?
Everybody get your IV order? Active? You go back to your work list. Your IV initiation is now on your work list.
You can also do it the other way too. You can't just button add, find it, and click it.
If it's not an orderable intervention.
Okay.
An IV start requires an order,
Well, it's got IV initiation on there.
but it requires you to document a physician order for it.
I
If you
see.
just go through the add routine,
Uh-huh.
it won't associate a physician
I
as
see.
having ordered it.
Okay.
Yep. But yeah, anything that's not orderable, that's how you would get it to your work list.
Okay.
Yeah. So we're gonna go in and document that we started this IV. So click on the little clock and then click document. Text probably will not have the option to document. Marcy, do you have the option? We ran into that problem. We need to get LPN's access because this is not only to document starts. For you, you would document starts anyway, but we'll also document discontinues, so all LPNs should have access to that.
You're already checking on it. Okay.
If you do not have access to document on this, go ahead and cancel it off your work list.
No. Okay, now, where's it at? And then if you can go, what's the time when you're gonna do it? Okay, go there. And they got one.
Take it out.
Yeah,
That's
so,
This one, take it off there. Oh, you got it.
is it just canceled?
Yeah.
Just that.
You have to, because it's order, so you have to state a different thing by the reason why it's.
Do you have to write in the reason? I can't get it to do nothing.
Do all that, put it into your.
Now Cheryl had to go through.
Add a location right now.
Did you go,
Huh?
back, where you at now?
I
Go back
need
on
to
there, status
cancel
two.
it.
Go over there on your status two. Put your, right under there, check on it. Okay, fill that out. Because it's smart. Marcy, did you try to cancel out?
I did.
Did you get it out? You didn't have to put a doctor's order sheet?
Why does your status do say 24 hours and mine
So
says
she
my
does
doctor
lost
20
it,
minutes?
Yeah, okay. Yeah, you
Did
put a
you
doctor's
refresh?
order. Yeah.
So you put saving lock then, or?
You girls got yours off, okay?
Yeah.
Okay.
Does it matter?
No.
You documented on it. Oh, you didn't document on the clock, you documented on the now.
Oh, okay.
Has everybody documented on their IV or discontinued it off your list if it's
I
not
don't know how to
applicable?
do the inch part. I don't know.
Oh, Catherine
Lee.
Lee, just pick something.
Pick something, Mary.
Did we have a rate? I don't remember.
Yeah.
You make one up.
But,
Now, if we were hanging the fluid, where would we document that? On the MAR. We document the fluid hang on the MAR.
oh, so I'm not hanging fluids, I'm just getting the IV lock in?
Right.
I think you're just inserting a needle.
Okay.
So you can save it, Mary.
Oh, mine is pediatric, I didn't even document it.
He won't let me click on mine. It won't. Is it because it's lolly? Is that why? Or
Huh.
No,
What the deal is.
okay.
matter.
So you had a pediatric kid?
I can't get it to
I'm only
click or anything.
14.
You're very big 14.
Let's see, you're already open once here. Go ahead and X out. Don't say.
I would try to see that.
Click on the
That's what we're going to see.
uncheck mark these that you've checked and uncheck mark that one. Now click document.
We're gonna help you.
The patient is, so.
Oh, there it
We'll
is.
give them some candy next week. We're treating you to our new Meditech problems. You get to have a crown or something.
Maybe we won't have the freaking flyers when they know it takes this long.
That's very true, very true. Good point.
Hey, I think I have a lot history. Good job, people.
Okay. You getting through her there, Sue?
Yeah.
All right, so we've started the IV and now we want to document that we're assisting the patient to the restroom. Where are we gonna document that?
Notes.
Yeah, ED nursing note. Click in the now column, click document, and type a note, assisted to the bathroom
Now, where's your
with one
ED
or
nursing
two
note?
assists, whatever.
Right here. Don't go to the, yeah, and a document. Are you, you found it, Mary? Karen, you found it? Good job.
What's under ED notes?
On your back, Suez.
ED nursing note,
Right
Oh,
here.
up here.
Up here.
Okay,
Yep.
gotcha.
Yeah, don't use those.
Okay.
Too much problem.
okay, the patient has peed, so let's go in and put in an intake or an output, actually, in this case. Document an I&O, recording their output. Just their output at this time.
Now, sometimes it's,
Yeah, just say that.
Get your calendar.
So that doesn't flow to I&O then, huh?
What?
If we put in 200 on output, it does not flow into your I&O?
Yeah,
Tab.
into your I&O EMR tab.
Oh,
Once you enter down.
You have to refresh your EMR.
okay.
Teachers, Mary, everybody?
Oh,
You all did okay? Good job.
Everybody there? Let's go. Now we want to document that the patient is back to the cart, so we assisted them back to bed from the bathroom.
So what do we turn on? Nurse's notes?
Back into the ED nursing note, document.
Yeah,
you wonder
sit
is
right on
done
it.
now again, it already says done.
Or you
Yeah.
can
Ours
refresh.
is saying like done in that column.
Yeah.
Like yours is moving over.
I'm refreshing after I document.
Yeah.
So push your
Refresh.
refresh button on your footer.
Yeah, there, pixels goes away. Check. That's it done.
At the bottom. hit
Return
refresh.
them to the bathroom.
And then you can go.
Yep, there you go.
Return from bathroom.
Yeah, just anything there.
You put your I&O in, did you put your output in? Okay, there.
You always have to use that little arrow because that helps mercy. It's strange, but in file, same. Now. That's your I&O.
Yeah.
Now you got it right, yeah, to the bathroom.
Mine still does not pop up on that I&O.
It may just
Okay,
take
just
you
put back to bed.
minutes for it to come across.
Yeah, return to the cart, walk back to the cart, whatever you want to say, I don't care. Okay, you can say. Now, and you can refresh, it takes those done things off.
Okay, so now let's say our patient is back to bed and they are feeling hypotensive, they're kind of dizzy. So we want to document, we obtained a set of vital signs and confirm that they are hypotensive, okay? So let's go in and document on vital signs. And let's document a low blood pressure.
Just the blood pressure.
Yep, just the blood pressure.
Can you put the blood pressure in? Okay, we gotta get an arm, I think. Did you pick an arm?
Get the new blood pressure location. Add a blood pressure location.
Yeah, that's my name. That's my name. Did you all get your arms
I
in?
did that one. So
Okay, did you do the
I
location?
should figure it out. I know that one. I did the same thing with you.
Yeah. Got a green again, what you gonna do? Got a green thing, what's that, what you gonna do? Not gonna work, is it? Okay, I'm gonna make it active. Did you do it in your left arm? Yeah. There you go. My name is, so you can turn it.
You can turn it.
I didn't say. Yeah. Maybe let's do that.
Fiddling around, nothing, actually.
Now, then say.
Okay, everybody caught up?
Everybody done?
So now we want to notify our provider that the patient is hypotensive and they're symptomatic. So we're going to go into our ER time intervention, the now column. click document. And we're gonna document that we've notified the provider. And why did we notify the provider?
Low blood pressure. Did you get it in there, Mary? Or what? Tissue? Okay, no. When you notify. I don't have notified or right. Just
So when
notified.
did you?
You want it under comment, is that what?
Yep, under comment.
Oh, I see. So blood pressure, low blood pressure, I guess.
Where you put that, oh, right here.
Okay. Okay. Alright. What? That's okay. Okay. That's it. That's it. Okay.
And when we notified the provider, we were instructed to increase the IV fluids, or possibly we did that on our own based on our nursing judgment. Where would we want to document that IV fluid rate change? On the flow sheet. So if you have access to, document on the IV fluid drip titration flow sheet. Click document. And go ahead and document your rate change in your fluids with the comment.
Oh, of course I can't do it.
Yeah. We have some questions about it.
Bless you. Bless you.
Okay, Cheryl, you got it? They let you do it? Okay, okay. I'm surprised because you read it. You just cancel out.
You have access to it.
Some of them do something.
Okay, now the provider has arrived. He's pretty fast in getting over here, so let's go in and document our arrival time. Time seen by provider.
Right there.
There you go. Check. And document. And it says when they arrive. Put in the time.
Sweet.
They arrive. Now, Chris? You gonna take care of it? Is it working mercy for you?
This, yeah, this part is.
Just slow. That's all you have to say.
Okay,
Just
put the time
we
in.
should put who you're
Okay,
notifying.
what's the deal, Cheryl?
what's that?
Is there a place you should put who you're notifying?
Yeah, we could maybe include that. I mean, you're gonna notify the provider that's associated with that record, I would imagine, but I suppose there could be an instance where you have to notify somebody other than if he's not or she's not available. Yeah, that's a good idea.
Is yours working okay, Cheryl?
Okay, so we can process this one through. We're gonna say patient got better, the bag of fluid infused, and we are now ready to discontinue the IV. So let's go in and document our IV discontinuation, which is actually going to be under the IV initiation intervention. It's kind of messed up. I think we're gonna maybe try to reword that a little bit. Click in the now column and click document. And indicate you're discontinuing the IV. This is going to be recallable from the information you just put in, so if you want to recall any of that, you can recall that information that's applicable. Now we want to document the IV intake. So
She's
go
not
back.
quite ready yet, just a teeny bit yet. and we'll be
Okay.
done. Sorry. Okay, we're
We'll
ready.
go back to your INO intervention. Document now the IV intake.
Sue, are you doing okay up there?
I think so.
Okay.
Everybody caught up there?
Are you done, Shannon? Are you just looking again?
Okay?
Yeah, I think we're okay.
So we're ready to discharge our patient. Does anybody remember where we go to do that? Yep.
Where can you
Discharge.
see, before I discharge, where can I see that INO and stuff? Is there somewhere else to see it, or just right where we put it in?
In your EMR tabs here, there's this INO tab. You do need to refresh your EMR, and we have found that sometimes it does take a few minutes for that to actually cross over and save into the EMR.
Oh, I see, okay,
So it may or may not be there already.
I see.
Sue's no one.
Looks like mine is there.
Did you put yours in? EMR on the site. Okay, yeah, I'll do
Yep.
it so you can see where to go.
So now if we go to INO, it'll show us.
Or go
Yeah.
to EMR.
To EMR,
Okay,
yeah, to the INO tab.
okay.
Okay, now how do I get back to our office?
Okay, we are going to now discharge our patient.
Did you discharge yours, Mary?
Okay, they're ready to go. So go to the discharge tab. Down at the bottom,
There at the
bottom right.
Okay, you're right, Sharon.
Okay.
Sharon, you're probably gonna ask that.
We needed to send them with instructions. You do the drop down for instructions. You select the complaint of scheduled ER. Your generic ED dismissal instructions are available to you if you wish to use those. For practice, go ahead and select the generic ED dismissal instructions.
Yeah, and you schedule
Did
the,
it?
Click OK.
okay, now what'd you say when you got to? Oh, this,
Click
okay.
on them, click OK. They'll display. Let's go ahead and select a standalone form. The patient's requesting to have a proof that they were here for their employer. So we're going to select the patient seen by, provider, standalone form. Click OK. That will now print as part of our packet.
How'd you get to that standalone form?
Do the drop down
Okay.
and then select it from the list.
Okay, right here.
Okay.
And then, seen by provider, I think that's what she wanted. Okay, there you go. Okay. It's right up there, do you see it now, Sue?
Mhm.
Okay.
We're going to attach a referral to this patient as part of their discharge packet. We want them to follow up with Dr. Brennan. And in that referral, we want to tell them to follow up in 1 week.
Go to the
Do you remember how to get there?
Additional text you put it in, or?
Go to this little details clock over here on the side of the referral and click on it. And it'll launch you into the details screen of that referral.
Oh. And what'd you say? 1 week?
Follow up in 1 week.
Okay, follow
You
up.
can use the calendar and actually designate when 1 week will be. You can also add a note to follow up in 1 week.
Okay. Yeah. And so to see that it's very much it's there. Right. Good job. You okay there, Marcy? You doing okay now? Make sure you save it, or okay, Mary?
Okay.
Or you won't get it.
Click
There you go.
OK.
Yeah, they look like they're okay so far.
Okay.
Still right. Make sure you save, okay?
Does anybody remember what we have to do in order to be able to print this packet?
The language.
Pick a language. Yep, print language, English.
Got it?
Now, if we were ready to go and wanted to print this, we would go down here to print packet. We're not going to print packets for today. But if you did push this print packet, you should be able to do a preview, lots of P's, and see what would all be in that packet if you want to.
Just like what we passed around this morning is what it's going to look like, okay?
So from the discharge plans, we're now going to go to the discharge data.
Right beside you, just
Right,
right
yeah.
up on top.
In your discharge data, you'll see the ED provider and your current status will default in. Clinical impressions and other ED providers, nothing to put in there. We will put them in a disposition of home. They're going to go home in good condition. You will see down at the bottom, we have documented on all the required documentation. Everything's filled out here. However, the discharge date and time is grayed out. Do we remember? Anybody remember why? Why can't we input a discharge date and time?
They're not fully registered.
That's right.
Good job.
We've not fully registered our patient yet, so that's going to be our next step.
Okay.
Does everybody have this info inputted here?
Everything there, Cheryl?
You do, click save.
Right next bottom. There you go. Save. Okay, save.
This is totally off the subject, but I have some bad news. They had to turn the air conditioner on upstairs, and she said it's negative cool down. Just so you
I
know.
can already tell.
I can
It's
feel
cold,
it.
yeah.
I can feel it too.
Yeah.
All right, so let's go back to the tracker. Close current chart, yes.
So close.
Hit tracker up in that top corner, Mary, on the
Yeah.
right.
Yeah, there you go. And then close chart. There you go. Okay. Add it. Did you go to tracker yet and close your chart? She said close your tracker.
Yeah. All your charts should be closed out.
Oh, no, close chart. Close chart. Okay. Right.
Okay, highlight your person on the tracker in green.
Let's go back to your name again.
And click registration. We're going to register our patients now so we can process the discharge.
Look familiar?
So we didn't get it registered.
All we did was that initial pre-verified date of birth and got them on our tracker. We've not completed the full registration yet.
Okay. Doesn't take long, it just takes some steps.
There's just a few starred areas that have to be completed to process the registration, okay? So I want you to go in and fill in those starred areas. You can make stuff up. Only the starred areas, the required fields. You don't have to fill in every field.
No, I think that's, okay.
Why do they ask Hispanic, not Hispanic?
It's a government thing. It's
That's
not
kinda-
required.
Discriminatory.
I think they're tracking population.
Yeah, you don't need to?
So what's your alternate address? I don't know. Oh.
P.O. Box and street address.
If you get to the guarantor and it's the same person, just put capital S, capital P, and that will default in same as your patient. It's kind of a quick,
She's having to do her alternate
A quick.
address. Trying to close it. Okay.
I don't.
You gotta go to the top and keep going along.
Oh, you go clear across. Oh.
Yeah, there's no contact.
Next. Oh, okay.
So if the address is the same, what did you say?
SP, capital S, capital P.
Yeah.
Here, just do this,
And you go across to it.
just for today.
See, it's going to.
Yeah.
See what-
Next.
Oh, okay.
Okay, SP and enter, and all that next. So now go ahead and click next. So it's telling you there's 2 required fields. So we'll make up the social.
Okay. No, 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 no.
Oh, I have space.
Do you put a space in it or not?
No. And is patient a minor?
No.
You're a 14-year-old female?
Yes.
So you're gonna put a Y there for yes.
Put a social security number, you know, who's on the aspirin diet or?
It's gonna
No.
tell you how to, or mine.
It's like something wrong with it.
I think it might make you put a capital Y in there.
I think it keeps defaulting.
Yes.
And then click on this next field so it saves. So there you go. Now it should let you keep going. Now there's no required fields here, so you can move next.
Now, wait here and she'll tell you what to do next.
Go ahead and do the drop down and select insurance. Yeah, for your admit priority, go ahead and put, what did you say?
So that's right.
Yeah.
That's all right.
Yeah, go ahead. Next.
You girls doing okay back there? Yes.
Still processing the insurance, so hit next.
I think she said guarantors, was it SP Janelle?
Maybe that's
Next.
Different.
Me?
Yeah, I see where you're at.
Well,
I think next.
Okay, let's try that.
That's the first one, that's G.
Okay, hit next again.
American Family Life.
Here we go.
Okay, next.
Okay, nothing required, so hit next.
We didn't have to put it.
Nothing required.
Just maybe grab this.
Go next. You do have to indicate their admission priority, so go ahead and put ER. So do the drop down. Next. And you've got a little green check mark to save, so you can hit save. Do not print a face sheet, so we cancel. It's telling you you've registered your patient, so hit close there. And then hit close there. Now, if you refresh your EMR, your status should be at a registered status.
Now, see, some I didn't
Okay.
get eligible, they're on Cheryl, so that's probably wrong.
That means you have created an account. Yep, so you're good.
Cheryl didn't get it eligible.
Close that one.
I got it.
She didn't get an allergy because she can't verify allergies.
Yeah, and so you see, so we'll see how
You won't have that screen.
Yeah.
You hit refresh, Sarah, your pre-ER should change to a reg ER.
Cheryl, refresh your stuff, please. How are you refresh
Um,
yours?
okay, so you have to put a number in here?
Relation to patient husband.
There we go.
Good
Yeah,
job.
good to rest about.
So then.
You should be able to hit next.
Let's get back to ready for discharge.
I figured the last name
Saints.
For
Cheryl, my nurse Saints no more.
Don't have me, Mary, you'll be all right.
You need help, Stacy? Did it go through?
Yeah, I'm just checking to make sure.
Okay.
Thank
So
you.
this, if Dr. Weber coming back there, is there a cell phone we can do? Someone else supposed to be doing it?
I'm sure there will be, admissions goes through their admissions training, they'll go into these rooms.
Okay, so next. 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 And then if it doesn't next, look and see if you lost that.
It's just. And save. Should tell you you have an account number, so. Close that.
hanging there.
Then when
Yeah,
we
they
get
are.
this grant,
I'm telling you, this chair's killing me.
this registration, we want from another patient.
Yeah. Hit refresh, and now you should be in a registered nurse status. Okay,
It just takes time. Still good time.
does everybody see your name up there in a reg ER status? Now you'll be able to discharge your patient. So go back, highlight your patient and open the chart.
So the patient's waiting for us to do all this.
Go to
Three others
discharge.
too.
Honestly, I mean, this can be done at any time during their care. So, I mean, we could be completing the registration in the beginning if we want to.
There's that blank paper, like for new patients, if you just have them fill that out, then you have all that information.
To
as long
input.
as long as all that stuff is on that paper that's in here.
We're gonna go to the discharge data tab
The second one up
in the
on top.
discharge
Right
routine.
up on top.
Your discharge date and time should now be in green,
Right there in the middle.
or be able to document on anyway.
Oh, okay.
Put in a discharge date and time. And hit save. You go back to the tracker, it's gonna say close current chart, yes. Hit refresh.
Where did it say close? Mine didn't say.
Mine didn't say
that
close.
Didn't give you the option.
Just say just went to the, bullets or whatever in those charts.
Yeah. Just make sure your chart isn't open down at the bottom and you should fall off the tracker.
Who's chart?
Yep, close chart. Okay, and now hit refresh. You gone? Okay, good job. Are you off there? Yeah? Karen, are you off?
Are you off, Cheryl?
No.
Okay.
Girl, I don't see you on here.
No, maybe just refresh. There you
Are you working on Lolly? Are you Lolly tests?
Yeah,
Okay, you are still in a pre-ER.
there's 2 of them on there. Mine dropped off.
Oh, there's 2 lollies on there? Okay, I'll go in and take her off. Everybody get yourself off of the tracker.
Yep. Looks like it. Amber, you're off.
Go ahead and put it in
Yeah.
for now. And it'll default in the correct date and time for you.
Okay.
There you go, hit save. Hit tracker. Make sure you close your chart. So hit close chart. And now hit refresh. You should be off of there. Okay, Carly. Go ahead and open your patient chart.
You doing okay, Sue? Did you get it all?
Mhm.
Okay.
Go to the discharge tab. And discharge data. Put in a date and time, so just go ahead and put now, put an N, and enter. It'll default in the current date and time. Click save. Hit tracker. Close your chart. And hit refresh. It should be gone.
Okay.
Okay?
Good job, ladies. You did it.
You survived your first one. Woo!
Hooray, 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 hooray.
We'll take about a 10-minute break, then we'll put another one through.